This is Community Link, a public affairs presentation of State Broadcasting Corporation.
Hello and welcome to Community Link. I'm Yvonne Lamb Castillo. I have as my guest Dr. Ken Redcross, who is a specialist in internal medicine, and he founded one of the first full-service concierges, personalized medical practices in the U.S. Welcome to our program.
Thank you, Yvonne. Thank you so much for having me on. Good morning, everyone.
In the wake of what we have been going with increasing deaths from opioids and people being hooked on those things, could you give me just kind of an overview of what all of that is about?
Yeah, Yvonne, you know, this is a good question. This is a big question for those in the medical community and also for patients. Because like you said, we're seeing this a lot more in the news, and the big question is, who's at fault here? Is it the physician who are writing some of the prescriptions that are causing patients to be addicted to some of these medications? And I have to raise my hand and say, yes, we as a medical community need to take ownership of that. But on the flip side, the patients also need to make sure that they engage their doctor in conversations about other ways to heal, other ways to get better than using some of these addicting medications, which is the whole platform that I think is so important to get out there nowadays.
Backing up a bit, we use all kinds of medicine, some over-the-counter, some prescription, and some we think are not quite as damaging as others. How does a person first get hooked on pain medicines, and what are some of the most common ones on which they get hooked?
Well, I think the main problem, Yvonne, is when we're dealing with pain in patients or people, all of us are dealing with pain, I think we're looking for relief in all of the wrong places. For me, the thing that's important for my practice is that we go out and we get healing from more natural causes. Look, 125 million Americans each year, Yvonne, spend $300 billion in pills or pot or procedures that, quite frankly, do not work. So instead, everyone listening, let's figure out ways instead of the heavy, potentially addicting medications, let's go natural. Because I know that we can really treat and manage a lot of these things naturally if we just have, once again, a discussion with our doctor. The typical pains that I see tend to be that of muscle pains, joint pains, and head pains or headaches. And then that's what brings you into the doctor's office. So I think we should really touch upon some things today so that we can heal ourselves naturally.
And what would be the best process of going about this?
Well, I'll tell you, muscle pain tends to be a big problem. One of the bigger causes for muscle pain can be that of injury or overuse. And one of the big things you'll hear me talk about all day long is stress. Stress is something that we all have to really tone down and figure out ways to address. But when we're dealing with muscle pain, one of the best ways I love out of the diet tends to be that of turmeric. Turmeric is the base of a lot of Indian foods, but it has anti-inflammatory properties that we understand now. So turmeric is something that you can either put into your diet, either in pill form, or even add it to some of your meals each and every day. It's very, very valuable. But one of the other things that I found valuable for muscle pain tends to be a perfect relief remedy, I like to call it. It's a homeopathic medicine. It's derived actually from the mountain daisy. Now, if that isn't perfectly natural, I don't know what is. It's called Arnica montana. And the reason why I love that is that it's easy for patients to take. It comes in an oral form so you can put under your tongue. But not only that, it comes topically in a gel or a cream. The reason why I love it for this particular purpose is because it doesn't have that medicine-y menthol type of smell. And that's really important because patients don't want everyone knowing that they're dealing with pain with some of those other over-the-counter issues. The other reason why I love it is that it also helps for bruising and swelling, things that you tend to get with muscle pain. Now, as you go further and you figure out what can you change in your lifestyle for some of the muscle pain, Epsom salt is wonderful because we know that it appears to let magnesium run into the muscles, which also is very soothing for the muscles as well. So right there, we touched on three important things that are all natural, especially when we talk about Arnica montana, because once again, that's from the daisy family. I don't know how much natural we can get more than that. So I'd love to talk about these sort of things, Yvonne.
And one factor that has to come in is our general exposure to ads that we see on TV. And I imagine a lot of doctors have patients coming to them saying, I want this or I want that. How does that play into that whole process?
It's a big deal now because you're right. Now, a long time ago when I first started my training, the pharmaceutical companies didn't directly market to patients, but now they do. So when patients come in the room and into the office, I think it's important as well. I always say your doctor should feel like a member of your family. And when you think that way, you start to make better decisions to say, should we really start with some of these heavy medications? Can we also go naturally for this pain or that pain? We really need to have a talk and an engagement with one another. So when patients come to me with those things, we try to really talk about, okay, that medication can cause side effects. That medication can interact with your other medications. But guess what? Some of the other things that we can talk about actually don't. And they all come from the earth. And that's the same way I think everyone should start thinking these days.
Is there a school of thought where you would probably prescribe something to take care of the pain, maybe to take care of it permanently rather than simply to mask it?
Well, I think there is. That's a great question because that's a thing that you bring up, for instance, with OxyContin and Vicodin and some of those other things. Everyone needs to realize that really isn't treating the pain. You're right, Yvonne. It's just masking the pain. That's why when I talk about some of the things that we really look at naturally, those things actually work towards healing. Those actually go to the root of the problem most times. I mean, think about it. When we have those who have joint pain can be from arthritis or gout. Once again, stress can also play a part. But as we talk about that, the other thing we can think about is adjusting our diet, making sure that we have foods that decrease the triggers for the pain, such as processed food, fried foods, soda, sugar, things that we can really avoid to, once again, heal but not mask the problem. There's a relief remedy that's great for joint pain. Glucosamine is great. And in fact, we even know now that when you have a lower vitamin D, that may also increase joint pain as well. There's even a group called the Organic and Natural Health Association, and Yvonne, they've decided at their website, thepowerofd.org, to focus the entire year on getting the word out about vitamin D and setting it up so that you can actually have at-home test kits for your vitamin D. So can you imagine actually getting better by taking vitamin D, something naturally, and not taking some of these other addicting medications? I mean, that's really awesome when you think about it.
Now, in a few words, could you summarize, just say some things we normally have in our homes that we could use to help with pain, other than, say, making better food choices and making better choices about our exercise and so forth? What are some of you know about home remedies, how people talk about home remedies?
Sure.
Yes. Have we got
I do.
anything in our homes that we can use for pain?
Well, we do. I mean, a lot of it, once again, focuses, lots of times it comes back to diet because a lot of those things, when you'll hear people talk about apple cider vinegar does, in fact, have some benefit that we're thinking. Some of the oils that people love, peppermint oil, for instance. Peppermint oil, it's not in everyone's home, but funny, a lot of people now know about the benefits of peppermint oil for the abdomen, for abdominal pain. Also for joint pain is very helpful as well. So, really mainly for headaches as well, which can also help with peppermint oil. So there's a lot of things that you may have in your cupboard that you just do not know. But anything that's dealing with inflammation is the way to go. And that's why I mentioned those things like turmeric. And that's why I mentioned Arnica montana. That's why I mentioned glucosamine. These are natural remedies. And once again, they do not have necessarily all of the heavy side effects that go with it. So when you look in your cupboard, you'd be surprised. You really have a medicine cabinet right under your nose.
My final question is about the internet. A lot of us use the internet in order to get information. We kind of want to explore. Are there resources where people can go to get additional information about finding alternative pain solutions?
Yeah, so the Mayo Clinic has a wonderful site there where they have a lot of data-proven things that are important to look at, and that's the key for everyone out there. It's hard to look on the internet and believe everything that you read because it's key to know the source. So the Mayo Clinic, Everyday Health, a lot of those are a lot of people already know about those things, but they're very valuable to figure out the sources where it's coming from. And I would ask everyone, print these things out. Bring them to the office with your doctor. You should have an engaged conversation. It should be very exciting and very fun because we're trying to figure out ways to heal you naturally. So it should be a nice and engaged discussion. So bring those things to your doctor. Challenge us. Challenge us to do our research as well and see what the studies look like. See if they really do work. So once again, your doctor is a partner and should feel like a member of your family. So why shouldn't you be able to come and print some things out and have an informed discussion around them?
Thank you so much for talking with me.
Oh, well, thank you so much for having me. And if any of your listeners would like to hear more, please, my website is drredcross.com. That's drredcross.com. And my Twitter handle is @drredcross. Please reach out. I love meeting new people.
Thanks again. I've been talking with Dr. Ken Redcross, board-certified internal medicine physician. And thank you for listening to Community Link. I'm Yvonne Lamb Castillo.
This has been Community Link, a public affairs presentation of State Broadcasting Corporation. If you have questions or comments, write to Community Link, State Broadcasting, P.O. Box 130, Dublin 31040.